Good morning and welcome back. Today we have Elizabeth Larkins from Piedmont joining us. Thank you for being here today.
Happy to be here. Thank you for having me.
I'm excited. I want to talk to you about a few things. First off, virtual nursing. What is that? We hear it, we heard it a lot during COVID, but what exactly is virtual nursing?
Well, let me start with what it's not. So it's not AI. It's a human person.
Love that. I think that's good.
Yeah. Basically, we have found a way to maximize the nursing workforce by hiring people who are a lot of times at the end of their career. They physically have a hard time doing direct patient care anymore, but they have the best expertise and knowledge of nursing, and we want to keep them in the workforce as long as we can. So they're on the other side of a camera. They camera into the patient's room with permission. We have some safety measures around that if people aren't comfortable with it. And then they do the admission history. So when was the last time you were in the hospital? Have you had surgery? What medications are you on? They do the full medication list and validate that. And then at discharge, they do all the discharge instructions. And what that does is, number one, their focus is only on that patient for that block of time. So it makes the patient feel really special and listened to. And like, we have all the time in the world for you, which in healthcare, people often don't feel that way. And then for the nurse that is assigned to the care of that patient, they're not tied up with that labor-intensive task that takes a lot of time, and they're free to focus their energy on the rest of the patients.
That's incredible.
Because they know that patient's getting the attention they need.
That's incredible, and you do get that one-on-one. Now, what are the benefits of virtual nursing to your patients at Piedmont Macon? What do those benefits look like?
I think one of the benefits is that it's someone who is not rushing through the admission history or the discharge teaching, really taking their time, making sure to answer questions. A careful admission history can be delicate because we sometimes ask sensitive questions. How much alcohol do you drink? Do you feel safe in your own home?
Right.
And someone who's not rushing through that task, who, even though they're behind a camera, is making meaningful eye contact and listening, can sometimes elicit the deeper answers that we're looking for from a patient.
Wow, that is incredible. And what are the benefits, the primary benefits to Piedmont's nurses? I know we talk about, yes, it's good for the patient, but what about those nurses?
Well, we want every nurse to be happy with their job. If you're happy as a nurse, your patients are more likely to be happy in your care. And we find that the nurses that are working in direct care on a unit that have virtual nursing experience higher job satisfaction. And again, we think it's just because they don't sit in a patient's room with their mind going, what about that blood pressure next door? I need to do this for my patient. They can know that the virtual nurse is taking care of all those things for them, and then they can focus on their patient. But also for our virtual nurses, so many times bedside nurses don't want to stop working when their body is telling them it's time, and to keep their minds occupied with patient care for just a few more years is a huge benefit for them as well.
And it really is mutually beneficial. Now, what do you foresee for virtual nursing at Piedmont Macon Medical and Piedmont Macon North in the future?
Right, so this is just phase one, the admission, the discharge teaching, the medications. We really anticipate using the expertise of our virtual nurses to help us with some virtual precepting. So if a nurse is off orientation, but, oh gosh, I've never done this complicated dressing change, or I have to pull a chest tube and I haven't done that, for them to have the benefit of that virtual nurse being able to camera in and coach and advise and use their expertise even though they're not physically present. And we're also using them for some very specific things where someone's seated at a computer as an impartial observer, like during a cardiac arrest event. They can record everything that happens and make sure we have an accurate history, whereas the people that are in the chaos of the room don't always remember after the fact. When did we defibrillate? When did we give that medication? What were the labs that were called out? That person's just observing on camera, recording everything, and we're getting a really accurate history. So that's a phase two plan.
That's incredible. And I have to ask, if someone's watching before we wrap this up and they want to get connected, they like the idea of this, how do they sign up for a virtual nursing appointment?
Well, the simplest way, if you are interested, is to go on the Piedmont website and just click the links, and we have lots of information about virtual nursing available there. We actually have a great website for our patients.
It's very user-friendly.
People don't use it as much, so I'll put a plug in for that.
Okay, I love that. If you'd like to find out more, head on over